Hello everyone, welcome to this video. So in this video I'm going to talk about the anatomy of another bone which is known as the sphenoid bone. The sphenoid bone is basically this bone here outlined there by the pen. This is the bone. It's got some wings on the side, then there is this body here, then on the side here. So that's the sphenoid bone, essentially the one that looks yellowish in color on this specimen. So that's the sphenoid bone. So basically, the sphenoid bone is a single bone, and it is located in the middle of the cranial cavity and situated rostral or anterior to the occipital bone. Remember the basilar part of the occipital bone here. So basically, the sphenoid bone is located on the anterior aspect of the basilar part of the occipital bone. And so it lies along the floor of the cranium cranial to the basilar part of the occipital bone. So it forms part of the ventral aspect of the cranium. Now, in terms of description, this bone is usually described as being wedge-shaped, or sometimes it is said to, to be shaped like a butterfly. Yeah, it looks like a butterfly because it's got wings on the side, then there's a body there. Also, in some texts, you find them describing it as resembling a bat, that flying night flying animal. So it resembles those structures. It's wedge shaped, and also it kind of resembles a butterfly or indeed a bat. So it has a central body, which is this part here. That's the central body. And also it has two lateral wings. There is that wing there. If I turn the skull on the side, you have that wing that goes this way, and also it goes that way. Also on the other side, you have the wing going that way and also going this way. So in short, you have the body and the wings on either side. These are the lateral wings. And also there is a small process that goes towards a bone known as the pterygoid bone. That part of the sphenoid bone is known as the pterygoid process of the sphenoid bone. And this is rather the sphenoid bone is one of the bones that make up the orbit. So the orbit is this structure here in which sits the eyeball. So the eyeball sits there, and the sphenoid bone makes a contribution to the orbit. As you can see, some of the wings will go and form and articulate with other bones that contribute to the formation of the orbit. And the bones that basically contribute to the formation of the orbit include the sphenoid bone itself. Of course, the frontal bone is also involved, the zygomatic bone, the ethmoid bone, the lacrimal bone is also involved, the maxilla and the palatine. All those bones are involved in the formation of the orbit. So is the sphenoid bone. So those are very important aspects regarding the sphenoid. It also articulates with these bones, that is the frontal, the parietal, the temporal, the occipital, the palatine, and the vomer. Those are the main bones that it articulates with. So you can see its position is central, and it sends all these processes to the various bones to make articulation. So you have the frontal articulating with the sphenoid, the parietal, the temporal, the occipital, the palatine, and the vomer bones. And of course, there may be several morphological variations in the relationship between this bone, which is the sphenoid, and the ethmoid and the frontal bone. So it depends on the animal species, and also within species, it depends on the size and the breed of that species. So you can find variations in the relationship between the sphenoid and the ethmoid and the frontal bone in that respect. Now, some of the openings on the sphenoid bone, of course, the sphenoid bone has quite a number of openings on it. By openings, I'm talking about the foramina. So you have a number of them, and these include, of course, the most famous one is the optic foramen. The optic foramen, which in this specimen is that bone there. If we look from inside the orbit, I think we can see something. Yeah, so that is the orbital foramen or the optic foramen. That's the optic foramen. So that's one of the openings on the sphenoid bone, the optic foramen. So here I can show you it is that opening there. Then of course you have other openings. which are associated with the sphenoid bone. These include the dorsal or superior orbital fissure. So the dorsal or superior orbital fissure is that one there. That's big, that big hole there. That's the dorsal or superior orbital fissure. Then, of course, you also have the inferior orbital fissure. That's the one there. That's the inferior orbital fissure. Then you have other openings which cannot be demonstrated on this specimen. You have, for example, the foramen rotundum and the foramen ovale. All those are some of the openings that can be seen on the sphenoid bone. So going through again, you have a number of openings that can be found on the sphenoid bone. These include the optic canal, the dorsal or superior orbital fissure. Then you also have the inferior orbital fissure, and of course the foramen rotundum and the foramen ovale. Those would be the openings. Now the optic canal is important because it connects the orbit to the middle cranial fossa, and also it transmits an important nerve which is known as the optic nerve. So that optic canal is very important because it transmits the optic nerve, and also other structures are transmitted through the optic nerve. Structures such as the ophthalmic artery, the meningeal sheath, and also the sympathetic nerve fibers. So also as I said earlier, the sphenoid bone consists of three parts. There is the body, and of course the wings and the pterygoid process. The wings there and the pterygoid process, this process which goes towards the pterygoid, and of course you have the wings. Now, just talking briefly about these individual parts of the sphenoid, the body is located medially, and it is described as being roughly cylindrical. You can see it looks like more or less a cylinder, and it is flattened dorso-ventrally. And the anterior part of the body is mainly concealed, to some extent by the vomer and the pterygoid processes. So it's not very clear on the anterior aspect. Then the posterior end, of course, articulates with the basi occipital bone. So you can see the posterior end of this sphenoid bone. That's the posterior end, and it is articulating with this part of the occipital bone, which is the basi occipital. You can see the joint in between these two bones. That's the cranially you have the sphenoid. Then, of course, caudally you have the basi occipital. The body is also hollowed anteriorly by the what is known as the sphenopalatine sinus, and it contains on its dorsal aspect, of course, that is where you have the optic canals and the pituitary fossa. So it's something that you cannot see on this specimen because it's in the interior of this bone, on the dorsal aspect of this bone. You have the optic canals, where the optic chiasma is formed is on the sphenoid bone, and also you have the pituitary fossa lying on the sphenoid bone internally. Then the wings are composed of two parts. There is what is called the orbital wings, which go towards the orbit, mainly connecting with the frontal bones. And you also have the temporal wings, the wings that go towards the temporal bone. So those are the parts of the wings. So the orbital wings are the larger ones, and they curve dorsolaterally from the sides of presphenoid to unite, dorsally with the frontal bone. Okay, and also they anteriorly with the ethmoid bone. They connect anteriorly with the ethmoid bone, and posteriorly with the squamous part of the temporal bone. And they also have an overlapping portion of the temporal wing. So that's the wings of the sphenoid. Then, of course, the pterygoid process is a small part which underlies the pterygoid bone. And this is where it is located. That's the pterygoid process. Okay. So the sphenoid bone has a number of functions, of course, just like the other bones of the skull. But here it helps to form the base and the lateral sides of the skull. And this is in combination with the other bones, or with the orbital floor that form the orbital floor. And its main articulations with other bones helps to give the skull its rigidity. So meaning that it also it can serve as an attachment site for some muscles of mastication. So this bone contributes quite a lot to the anatomy of the skull. So there you have it, the anatomy of the sphenoid bone. Thank you for watching.